Bonus lecture, Tomas Cipriano de Mascara, The Wound That Marked a Statesman, presented by Professor Franklin Booton Soto. Among the many military figures produced by the Wars of Independence, few carried their battlefield history as visibly as Tomas Cipriano de Mascara. He would later become one of the most powerful and controversial men in 19th century Colombia. Soldier, diplomat, financier, reformer, Carlo, and four-time president. Yet long before he dominated national politics, he endured a severe facial gunshot wound that altered his appearance, speech, health, and perhaps his character for the rest of his life. This injury was not a minor scar romantically exaggerated by later admirers. It was a serious maxillofacial trauma sustained during the southern campaigns of independence, generally associated with the fighting at Barbacoas in the year 1824. The best Colombian biographical tradition describes the projectile entering through the mouth, knocking out teeth, fracturing the lower jaw, and exiting through the cheek. If accurate, this was a brutal wound by any standard, and in the medical conditions of the 1820s it could easily have been fatal. To understand the severity of the injury, one must imagine the anatomy involved. The lower jaw supports the teeth, stabilizes the tongue, allows speech articulation, and enables chewing. A musket ball entering the oral cavity could shatter bone, tear soft tissue, lacerate the tongue, destroy teeth, sever nerves, and contaminate the wound with powder, cloth fibers, saliva, and bone fragments. Death might come quickly from bleeding or suffocation. It might come days later from infection. It might come weeks later from starvation if the patient could no longer swallow properly. Mascara survived all three dangers. The battlefield setting made survival even less certain. Barbacoas and the surrounding southern theater were difficult regions of humidity, mud, poor roads, tropical disease, and limited medical infrastructure. This was not Paris, London, or Madrid. It was a war zone at the edge of Republican state capacity. The first treatment would almost certainly have been improvised. Companions or attendants would have attempted to stop bleeding with cloth compression, clear the mouth of loose teeth and blood, and keep the wounded officer upright so that he did not choke. Later accounts state that before a trained surgeon arrived, a priest helped remove visible bone fragments from the mouth. This detail is historically plausible. In frontier campaigns, clergy often served as emergency caregivers when no surgeon was available. One of the most striking details in Colombian tradition is that an English surgeon later came from Popayan to treat Mascara, after a delay of approximately 3 weeks. Even if the exact interval varied, the meaning is clear. Mascara likely spent a prolonged period in pain, swollen, unable to speak normally, unable to chew, and vulnerable to infection before receiving definitive care. 3 weeks with a fractured jaw in the pre-antibiotic age was medically dangerous. Bone segments could heal badly. Infection could spread. Scar tissue could contract. Loose fragments could die and become sources of chronic suppuration. That he survived long enough for later surgery suggests unusual physical resilience and determined nursing care. What kind of surgery would have been performed in the 1820s? Modern listeners should not imagine an operating theater with sterile lights, anesthesia machines, antibiotics, and titanium plates. None of that existed. The surgeon's likely objectives would have been practical and limited. Inspect the path of the projectile. Second, remove dead bone, tooth fragments, and foreign material. Third, reduce displaced jaw fragments into rough alignment. Fourth, establish drainage so pus would not collect. Fifth, stabilize the jaw sufficiently for healing. Sixth, preserve swallowing and speech as much as possible. The techniques available in that era were inherited from 18th century and Napoleonic military surgery. Comparative studies of facial surgery in the armies of Napoleon Bonaparte show that surgeons used ligatures, compresses, dental wiring, splints, bandages, and external chin supports for jaw injuries. If Mascara's mandible was broken, the surgeon may have used silk thread, linen ties, silver wire, or gold wire attached around surviving teeth to hold fragments in place. A leather or cloth chin sling tied over the head could support the lower face. Some patients were fitted with metal oral appliances or braces to maintain structure. This may help explain later references that Mascara wore a metallic support device in the jaw. Such a device would not resemble a modern implant. It would have been an external or removable mechanical aid. There was no modern anesthesia. Ether would not become common until the 1840s. Chloroform came later. Mascara therefore likely endured treatment under alcohol, opium tincture such as laudanum, physical restraint, or sheer endurance. Surgeons of the era often valued speed because prolonged pain increased shock and collapse. A fractured jaw being manipulated, wired, cleaned, or cut open without anesthesia would have been excruciating. This is not dramatic embellishment. It is ordinary surgical reality for the period. There was also no antiseptic surgery in the modern sense. Surgeons did not yet understand bacteria, though many knew from experience that cleaner wounds healed better. Instruments might be wiped, heated, rinsed in spirits, or washed with vinegar solutions. Dressings might be changed frequently, but sterile technique did not yet exist. The mouth, moreover, is full of bacteria. This made mandibular injuries especially dangerous. Common complications included abscesses beneath the jaw, chronic drainage, foul odor, fever, necrosis of bone, and death from sepsis. Mascara's later survival indicates that either infection was controlled, his immune system prevailed, or both. Recovery would have been long and humiliating. He likely could not chew solid food for weeks or months. He would have required broths, porridges, softened grains, eggs, stewed foods, and liquids. Weight loss was common after such trauma. Sleep would be difficult. Dressings required changing. Speaking would be painful or distorted. A young officer raised in a proud aristocratic household of Popayan suddenly became dependent on others for feeding, cleaning, and communication. Such experiences often leave lasting psychological marks. The wound appears to have produced permanent speech alteration. Contemporary opponents later mocked the way Mascara spoke. This strongly suggests that the injury caused durable functional changes rather than a cosmetic scar alone. A damaged mandible, lost teeth, cheek scarring, altered bite alignment, and use of a metal oral support could easily create whistling airflow, slurred consonants, nasal leakage of sound, or labored articulation. Sounds requiring precise lip and tooth contact, such as P, B, F, S, T, and CH, may have been especially affected. Political enemies reportedly used ridicule against him, as was common in 19th century polemical culture. The nickname associated with him in some traditions, linked to chewing metal or making metallic sounds, likely referred to this altered speech and jaw apparatus. Why does this matter politically? Because 19th century politics was oral politics. Men ruled through speeches, commands, courtroom argument, congressional debate, salon persuasion, and public ceremony. Voice mattered. Presence mattered. Diction mattered. Mascara had to overcome a handicap in the very medium through which elite authority was exercised, yet the same impairment could also strengthen him. Every listener knew that his damaged speech came from war service. What enemies mocked, supporters could interpret as proof of sacrifice. His face and voice testified that he had bled for independence. There are hints in family correspondence that illuminate how the wound was viewed within elite circles. Members of the Mascara and allied Julio Arboleda family networks often referred to health, honor, and service as linked concepts. Though private letters varied in tone, one recurring theme in aristocratic Cauca correspondence was that bodily suffering in public service increased rather than diminished masculine reputation. In translated form, sentiments from the period often resemble phrases such as, "He has paid with his person for the patria," or "Scars earned in service speak more loudly than titles." These were not empty compliments. In post-independence Colombia, military wounds could convert into social capital. Family circles also worried about marriage prospects, vigor, and stamina after severe injury. In elite households, health was political because dynastic continuity depended on it. That Mascara later advanced vigorously suggests that his family did not view him as broken, but as tested. Psychologically, the wound may help explain traits later associated with Mascara. Contemporaries often described him as proud, combative, intensely self-confident, sensitive to status, and unwilling to submit to insult. A young man who survived disfigurement, pain, ridicule, and prolonged recovery may emerge with sharpened ambition and a hardened sense of self. He had confronted mortality early. He had endured suffering others only discussed. He had learned that public mockery could be answered with force, success, and rank. This pattern appears repeatedly in military political cultures. By 1830, Mascara was no longer merely a provincial gentleman from Popayan. He was a veteran officer of the independence generation, visibly marked by combat, connected to powerful family networks, and increasingly conscious that military distinction could rival inherited pedigree. The deaths of older civilian founders during the Reconquest had opened space for armed younger men. Mascara's wound gave him legitimacy in that rising order. He could claim bloodline through family. He could claim merit through service. He could claim sacrifice through scars. Few credentials carried more weight in the Colombia of the 1820s. Modern maxillofacial surgeons would regard his survival as fortunate. Today, such a patient would receive airway management, imaging, fracture plating, antibiotics, reconstructive dentistry, nutritional support, and staged rehabilitation. In Mascara's era, survival depended on crude stabilization, surgical courage, luck, and constitution. That he not only survived but rose to dominate national politics makes the episode historically remarkable. Thus, Mosquera's facial wound was not incidental biography. It was part of the making of his public persona. It altered his speech, changed how others perceived him, and likely changed how he perceived himself. Many politicians inherited status. Mascara carried his credentials in his face. Sources consulted in preparation of this lecture include Colombian biographical studies of Tomas Cipriano de Mascara, family correspondence traditions of the Mascara and Arboleda networks, Colombian surgical historical reviews identifying the barbacoa's jaw wound, comparative studies of Napoleonic maxillofacial surgery, historical literature on mandibular fracture treatment before anesthesia and antisepsis, modern oral and maxillofacial trauma references on long-term speech and jaw complications.